Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Pedro, tell me what's going on with your knee.
Right now,
knee.
nothing. Okay.
Okay. So tell me what's happened, a little bit history about your knee pain. How long you had issue with your knee?
Well, how long have I been?
You wearing this brace and you using this cane. How long you have issue with this knee?
A year.
A year? Okay, so what is difficult for you to do? When do you feel pain? Standing, walking?
Walking, standing and walking, yeah.
How much pain from 0 to 10? 10 is emergency room.
Well, as you can see, I almost fell a while ago. So
When coming to the treatment here room, that he was almost falling, so he did not fall.
no.
Yeah, I carried him. Not really, I'm not that strong, but I'm trying to work on it. All right, so tell me how much pain when you put weight on your knee. We're gonna focus on your knee now, okay?
I guess around 7.
Around 7. What kind of pain? Sharp, dull, aching?
Pretty sharp, yeah.
Sharp. And where do you feel the pain? Show it to me here.
Right in there.
In the front
right,
here?
Right in front,
and
yeah.
what about inside? Do you feel anything inside?
Yes, inside. Sometimes it feels back here.
In the back too?
Yeah.
Why are you wearing this brace?
The doctor gave it to
He
me.
gave it to you. Do you feel
Yeah.
more balanced with that?
More balance, yes.
Yes. So tell me what kind of treatment you had this year. Like you said, you've been having this issue for a year. So what kind of treatment did you have for your knee this year?
Well, whatever they did, I don't know exactly.
Did you have physical therapy?
Yes.
Okay. Did you have cortisone shots?
Oh, they don't do no good.
Okay. So cortisone shot, physical therapy. Did you have like viscous, which is the cushion in the knee shots?
I don't know what kind of shot they gave
What
me.
kind of shots? See,
I wasn't with him when but it was for the cushion.
for the cushion,
Trying to build a cushion.
yeah, that's
Yeah,
one of
yeah.
them. So you had those, and what else? What other treatment he had for this knee?
Nothing much because they keep.
What was the recommendation of your doctor? Because he said you
Oh,
went to different
they
doctor.
said that since none of this is working, they wanted that a knee replacement would be recommended, but he's too old for a knee
How old
replacement.
are you?
87.
87 young. Okay. So what other recommendation? So the knee replacement, because you probably found a lot of arthritis in your knee. Okay. So what we're gonna do now is actually I will have you stand up and walk with your walker, your own way, and then not walker, it's cane. Okay. So you can get the front shot. I'll be closer to him. Okay.
See, it hurts right now. It hurts behind the leg.
How much from 0 to 10? How much pain?
Well, it's just starting right now, but it hurts right here in the muscle.
So before the video, he was actually almost falling because he was holding the cane
Over here.
on the good side.
Yeah.
Yes, and let's show them the on the good side. I'm here closer to you.
How you were doing it.
He was holding the cane, and we'll turn around,
Yeah, we're
Okay.
walking like that.
walking like that. And is that what they told you to do?
Yeah.
Okay, turn around. Okay, technically the right thing to do it is actually holding the cane on the bad side. So he will have wide base of support. And the other problem, he should not have a cane because his balance is really bad. He should have a walker. So we're gonna try now, change the cane to the walker. Okay. Not walker, I'm sorry, quad cane, from cane to quad cane, okay? And just walk like this and tell me, can you tell any difference with walking with your balance and
Yeah.
everything?
Yeah.
Turn around. What is the difference when we change it to the side that's supposed to be and
Well,
change
the
it to quad?
pain is less now.
How much from 0 to 10?
It came up quite a bit.
0 to 10?
Yeah.
How much?
What, About 3, I guess.
3, okay, but it used to be 7. So now we have to have the correct assistive devices, and then I'm gonna work with him, okay? So I will have you lie on your back, head over here. May I use this? Yeah, sure. Okay. Sorry. Okay, so we'll have you lie on your back, take your brace off. We're just gonna focus on the knee for now, okay? Because you said you have issue with your foot. We'll do that in both. Shoes off. So you're not able to bend your knees to take your shoes off, okay? Is that your phone? Your
He
watch?
doesn't know how to turn it off. It'll go off.
There you go. Went off, okay? You see? You just get a little bit closer to it and it went off by itself, you know?
Yeah, he has difficulty putting his shoes and socks on.
Yeah, I can see that. We're gonna take his range of motion now to see, and I want you to remember those numbers, okay? I'm gonna be in a test. All right, so let's bend your knee. Bend. Okay. So now his knee flexion is 110. Remember this, it's 110 knee flexion. Okay? So make sure everything I do is pain-free, okay? So if you feel any pain, let me know and I will take it easy. Bend this knee. Okay. Let's pull this up. And get some. How does this feel?
Okay.
Okay. So most of your pain was weight bearing when you put your weight on your standing.
Yes.
Okay. So we're gonna work on that, and we'll test it afterward. We'll have you walk, but with the right cane, the quad cane, not the single leg cane. So you want to make sure the cane is on the bad side, because the problem is you want to take the weight off of the bad side.
Okay.
So if your cane on this side, you're not really taking the weight off. You're actually leaning more to this side, so which will give you a smaller base of support. When you have small base of support, that's will be like causing more balance issue. But if you have a wide base of support like this, you are steady on the floor, and that will decrease your risk of fall. So you have to have it on the left side, the side that you have that weak, and you want to take the load off that side. Does that make sense?
Yes, yeah.
Okay. It's a very good example. Okay. Okay. So I'm gonna work on your scar tissue. Make sure it's not painful. Okay. Can you roll this pants up a little? Your shorts up a little bit? Yeah. And I will show you the scar tissue actually. You will feel it with these tools, and sometimes we hear it with some patients, some areas. You feel this bump? That's a scar tissue.
Oh, yeah?
Yeah, it should feel like nice and smooth here. Okay. You feel this?
Yes.
Yes. Good. Do you want to feel it, or are you okay?
That's fine.
All right. You can watch it. You can see the scar tissue here, those bump.
Yeah, I see it.
It's like the tool is like going like this.
Yeah.
Okay. So, and then this is how nice and smooth. You see, nothing in the middle. You know. So you definitely have a lot of scar tissue around this area. He probably, based on his history, he probably have arthritis because, they did images and they put vascus and stuff like that. So probably have a lot of arthritis inside. He could have a scar tissue actually inside. So I'm just gonna release for now the superficial scar tissue the one from outside, with those tools. We'll see how your hair respond. If you still have issues, scar tissue internally deep, I will work on it next time.
Okay.
I'm gonna do more like different stuff to really break the scar tissue in the joint itself.
So it's possible to break it on the inside?
Yeah, with certain maneuvers, it's possible. It depends on the location of it.
Okay.
It's hard to tell until we try the inside because we don't know what is the. It's usually longer, the one inside. It's the outside is much easier with those tools because we can get there. The inside is just there's certain maneuvers I have to do, but it's very on the location, you know. But at least we clean it from outside, so when you just eliminated layers of scar tissue that might cause an issue, and you feel that, yeah? How that feel?
Feels good.
Any pain, discomfort?
No?
Did anyone work on your knee? You said you had a physical therapy before.
Yes, but not like that. Like
Just massage?
just massage, yeah.
Yeah, massage is not gonna break it. You have to have tool to really break it, and it's hard to break it with hand. I feel bad for whoever use their hand to break scar tissue. Is that too much or it's okay?
Sorry.
It's alright, okay. Okay, so now I will have you actually lie on your side,
Okay.
this side, okay? So you're gonna turn and lie on the right side. Okay. So I'm gonna work on the back. So you said you feel the pain in the back too, yeah?
Yeah, oh yeah.
Okay.
Yeah.
All right, okay. You comfortable like that?
Yes.
Okay. Is that too much or it's okay?
It's okay.
He has a scar tissue here too, in the back. I will show it to you too. I don't know if you can hear this. Can you hear this sound?
Yes.
That's grinding here.
Yes.
That's a scar tissue. The good thing about this tool is actually the design and the material. It helped to actually hear the scar tissue. So I can hear it, I can feel it, and patient can feel it. Do you feel that?
Yes.
Feel all this bump there? Yeah. Okay, and here? You hear that?
Yeah.
It's loud here. This bumpy area. Okay. It's not too bad here actually. And here?
Yeah.
And you can see, look,
Yeah,
look, look,
I
look,
can see
look,
it.
look, look. So you hear it, you get vibration, I get vibration here, I feel the bump, and patient can feel it. Okay, so I will take both of your shoes off, okay?
Okay.
Because, you know, it's gonna take, because I want you to walk like even. So we took one off. Let me actually measure your range of motion. Let's lie on your back again. So it was 110 knee flexion, okay? Okay, I'm gonna measure it again. So it was 110 knee flexion. I will have you flex your knee again and tell me how that feel. Okay. So it's 114. Oh, 1 second. There you go. We can get to the right spot. Okay. So yeah, it's about like 112 here. Not too bad. Is that as far as you can go? Oh, there you go. Now you bend it. How's that? Wow. Well, 135 now. How does that feel?
Felt pretty good.
135.
Wow.
It was 110. Let's do it again. So we'll show them. Bend your knee as far as you can. Good. 135 again. It was 110. Good. So let's have you stand up, and we're gonna use right cane on the right side, and we'll see how you feel. Okay. And I want you like, it was difficult for you to lift this up and take your shoes off. Let's do it again. Imagine you're gonna take your shoes off and see how that feels. You definitely have some muscle weakness. Can you feel a difference?
Yes.
What the difference?
Pretty good.
He's actually going back and forth. We need to do some strength, but compared to the first time, he was just.
Yeah, you barely.
Look at this. Yeah.
Yeah.
How's that?
That feels real good.
Yeah. So we still have some work to do, but this is not bad for just a few minutes of treatment. So I will have you walk back and forth and tell me, do you feel pain? No pain? You know, how much? Going back and forth. How does it feel?
It feels good. There's a little pain right there.
On the front or inside?
Front. I think it's in front.
Okay. How much from 0 to 10?
It's about 2 now.
2. Okay.
It was real bad at first. It was about a 7, I think.
Okay.
But it feels good.
Okay. Let's have you sit here. Okay. We'll sit here. We're gonna work again on his knee. Do a couple of things. Okay. I'll get a stool. No, just sitting. Yeah, in this position. Oops, sorry. That's your fault, it's not my fault, okay? No. It's right in here, yeah?
Yes.
That's where you feel it, where the scar tissue. How's that feel?
Feels good.
Yeah, it's good. Has a little scar tissue.
Yeah.
Not too bad actually, but
I'm really surprised. I thought he'd have more scar tissue. So.
yeah, he has thicker scar tissue
Yeah, right
here.
there. Yeah.
That's a thinner scar tissue.
Yeah.
But the scar tissue is scar tissue.
Yeah.
You know, you could have like really like a marble, not marble, like green feeling scar tissue, and cause severe issue, and you can have like a little bit bigger, but it's not causing a lot of issue. It depends on the location.
Okay.
And the location and what pushing against. If it's pushing against like nerve or artery, or in the location that you don't have enough room for scar tissue, that's gonna cause more issues.
Okay. But I knew you'd find scar tissue with all his injuries. I knew you'd find scar tissue.
Yeah, I will not be surprised because you know he did not have a like scar tissue release, so you know, and he had those injuries, so it's you know, as we get older, our body ability to break scar tissue decrease significantly, so I'm not surprised. Let's walk again and tell me how this feels from 0 to 10. How's that?
That feels real good.
0 to 10?
Hope it stays like that.
Yeah. 0 to 10?
Yeah. No, I'm 0.
0?
Yeah.
That's beautiful. Good.
Yeah, really.
You can have a seat.
It's funny.
Walk back and forth again. Let's do more. Yeah.
Huh.
Yeah.
How does that mean, huh?
Yeah, you look good.
Matter of fact, I don't need this.
Well, we'll do it for safety until we work on your balance. Oh,
Yeah.
well, okay, let's show up. Wow, look at this. So he came with the cane.
He's actually bending it.
How
Yeah,
about that?
look at that. His balance look better, you know? Yeah. Good.
Should have
Beautiful.
brought me here before me, huh?
Yeah. How was that?
Feels real good, doctor.
No cane.
Yeah.
You can turn around, and you had physical therapy before, so can you tell us the difference between ASTR and what you had before?
What I had before was they didn't do no good.
Mm-hmm.
It did. Now I feel the different. I feel like I'm back to normal.
No cane.
No cane.
Awesome. Beautiful. Thank you.
I can't believe it myself. Thank you, doctor.
Yeah, thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.